866-503-9746, 866-503-9746, and at fortify.com.
Hi, this is Dr. Michael Lange, board-certified optometric physician and certified nutritional specialist, and the founder of the Lange Eye Institute and Fortify Vitamins. I've hosted the very popular Ask the Doctor program since 1993. I educate you on the latest advancements and natural approaches to eye disease and total body wellness. I'm Dr. Michael Lange, helping keep America fit and healthy.
The Lange Eye Institute in the Villages and the Fortify Nutrition Center on McMullen Booth Road in Clearwater. Online at fortify.com. And listen to Ask the Doctor Saturday morning at 9 on AM 860 The Answer.
Maybe it's hours a day spent in front of a computer screen or poring over documents and diagrams. Maybe as you get older, you struggle later in the day to focus on your favorite book. Whatever the reason that you find your eyes tired and that you struggle with eye fatigue, it's time to try Fortify Focus. Fortify Focus contains the powerful ingredient astaxanthin, a natural supplement discussed time and again among those like your community as a powerful solution for fatigue due to oxidative inflammation. Natural astaxanthin, the key ingredient in Fortify Focus, works at the mitochondrial level to support improved muscle endurance and recovery, helping to refresh your tired eyes and more fully enjoy all that you see. Order Fortify.
Concentrated in a state-of-the-art at fortify.com. That's fortifeye.com, or call 866-503-9746. That's 866-503-9746, 866-503-9746, and at fortify.com.
Hi, this is Dr. Michael Lange, board-certified optometric physician and certified nutritional specialist, and the founder of the Lange Eye Institute Fortify Vitamins. I've hosted the very popular Ask the Doctor program since 1993. I educate you on the latest advancements and natural approaches to eye disease and total body wellness. I'm Dr. Michael Lange, helping keep America fit and healthy.
The Lange Eye Institute in the Villages and the Fortify Nutrition Center on McMullen Booth Road in Clearwater. Online at fortify.com. And listen to Ask the Doctor Saturday morning at 9 on AM 930 The Answer.
Ask the Doctor with Michael Lange begins in 10 seconds.
When it comes to your health, are you seeing the check engine light come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortify Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lange.
Okay. Good morning and welcome to Ask the Doctor, or it's Ask the Doctors this morning. I'm your host as usual, Dr. Michael Lange of the Lange Eye Institute and Fortify Vitamins. I've been hosting Ask the Doctor since April of 1993. I tell you, folks, time flies when you're having fun. Started on a little AM station in Ocala, Florida. Country Jim Kirk gave me an opportunity, and now we're coast to coast on the Ask the Doctor network and live video streaming all over the world. So welcome to Ask the Doctor. If you're new, who's Dr. Lange? Well, I'm a board-certified optometric physician. I'm a certified nutritional specialist, founded Lange Eye Care and Associates March 15th of 1993. We opened 14 locations in the state of Florida, 3 LASIK surgery centers and 1 cosmetic surgery center. And I was blessed about 6-7 years ago to have a big company want the practices more than I did, bought everything except the Lange Eye Institute. So I hail from the Lange Eye Institute in the Villages, Florida. And my co-host also hails from the Lange Eye Institute. That is Dr. Susan Summerton. Dr. Summerton is getting ready to catch a plane. And so she's on her cell phone. Good morning, Dr. Summerton. How are you?
Hey, good morning. I'm calling in from beautiful Ocala this morning. Horse country here. It's a beautiful day and looking forward to answering callers' questions. And we're here. Whatever you got on your mind, nutrition and eyes, we're happy to help.
We are live. This is March 2025. We apologize. We were at the Vision Expo East, the largest Vision Expo for eye doctors, I think, in the world, in Orlando all last week. Fortify Vitamins was one of the sponsors, and Dr. Summerton and I were at the booth. And we're going to talk a little bit more about that in just a minute. But let's open up the phone lines. If you got a question regarding your vision or eye care, write this number down. It's 813-282-8283. One more time, it's 813-282-8283. You can also come to the Fortify Nutrition Center today in Clearwater. I will be there about 1 o'clock from 1 to 3. Remember, this is March 1st. So come to the Fortify Nutrition Center on McMullen Booth Road, right there in the Bayside Bridge Plaza next to Publix. Can't miss it. It says Fortify Nutrition. I will be there from 1 till 3. So come on out, pick my brain regarding nutrition, anti-aging, wellness, the whole 9 yards, and maybe we'll try some of the new samples of proteins and rejuvenates and superfoods that we have. We'll mix them up and let y'all give it a try. You can learn more at fortify.com. So if you want to learn more about the supplements that we've developed, the evidence-based, fully transparent supplements that we started out developing for the eye, but now we're whole body wellness, sports nutrition, beauty, the whole 9 yards. So go to fortify.com. That's FORTIFEYE, fortify.com, kind of a play on words since we're eye doctors. And you can also follow me on Instagram. A lot of you follow me on Instagram. We've got about 60, 70,000 followers now and growing. And that's simply Dr. Michael Lange _ on Instagram. Dr. Michael Lange _ There is a lot of fake Instagram Dr. Michael Langes out there. I'm the only legitimate one. I have a blue check. It's Dr. Michael Lange _ So check that out. Also, you can go to my regular website, and that's just drmichaellange.com. And it'll link you up with our YouTube and Facebook and stuff like that. All right, one more time. Phone lines are 813-282-8283. That's 813-282-8283. Also, I want to mention good morning to New Orleans listeners at WRNO, my old stomping grounds. We will be in New Orleans for a live show on March 22nd. That's a Saturday morning, from 7 to 8 in the morning. So you can call this toll-free. Well, this number's not toll-free, but it's not very expensive. You can call this number. We'll be running it. So if you're in the Tampa Bay area, anywhere globally, you can still call the 813-282-8283. I'm pretty sure that's the number we'll be running when I'm live from 7 to 8 in New Orleans. Remember, that's an hour earlier than we are here. All right, we got a lot to talk about today. We had a really pretty good show, Dr. Summerton, at the Vision Expo East, and we invested in a lot of pretty cool new technology, didn't we?
We did. Vision Expo is basically a convention that portrays all the new frames, all the new equipment related to eyes, and people come from all over the world to see what is the latest and greatest. And we spent a lot of time visiting all the booths and learning about what we want to do and how we can better serve our patients. And we're really excited about what we have. We have new equipment for dry eye. You know, we always talk about dry eye on the show and what we can do because it is so prevalent and so many of our patients struggle with it, that we want to make sure we have everything out there and all the different options so that we can improve their vision with the dry eye, so we can make them feel more comfortable. And this IPL is one of them, intense pulse light therapy. And then we also have a piece of equipment that can help with lid laxity, because one of the problems is your eyelids are like your little windshield wipers, and they are so crucial to smoothing out your tear film, supplying your eyes with that perfect thickness of tears so that you can see clearly. And so now we have another way, non-surgical, to improve that lid laxity that we're really super excited about.
Yes, we really are. And we both tried it, and it's not painful at all. And we just had like a 3-minute session, and it works quite well. So one of the devices that we purchased is called Lumenis Opti Lift. The Lumenis Opti Lift. Lumenis is one of the biggest players in the cosmetic surgery and the laser market. Lumenis Opti Lift uses RF frequencies and something called DMSt technology, and this tones and tightens the paraorbital area around your eyes. So it fights against the natural sagging from aging. Think about it. All of you that have saggy bagginess under their eyes, all these crow's feet, poor blink dynamics. You can't blink all the way. Your eyes are extremely dry. This is going to be amazing for this. So not only is it functional, so Dr. Summerton and I love it because it helps dry eye dramatically. As a matter of fact, it improves tear breakup time by 287%. That doesn't mean a lot to you guys and gals that are listening, but tear breakup time is one of the things doctors measure for dry eye patients. 287% improvement by using this Opti Lift, which is pretty amazing. Remember, 68% of people that have dry eye suffer from some sort of lid impairment problem, lid closure. They don't close their eyes enough. They don't blink properly. And about 80% of people that come into the eye care center actually have some kind of eyelid problem. So now we have a non-surgical, non-invasive, painless way to help with baggy eyelids and sagging of the face. And we can go down possibly a little lower and might even give you a little bit of a lift on your cheeks as well. So it's pretty exciting. And Dr. Summerton mentioned the Lumenis Opti Light also. That's an IPL. That does not stand for intense pulse laser, intense pulse light. It uses just a frequency of light, and it helps with what we call meibomian gland dysfunction. We talk about dry eye on this program all the time. We do the natural approach for dry eye. We heat the lids, we clean the lids, we nutrify the lids with the omega-3. And we use lubricants like Optase and Oasis tears. And we do all that, and then we might do something like thermal one-touch to open the meibomian glands. And we can do, amniotic drops, amniotic fluid drops, amniotic membranes, all of this for dry eye. But now we can actually affect the inflammation in the meibomian glands, the things that are actually, the cause of this dry eye with the IPL. And Dr. Summerton, I think this is probably, if it's not already, it's going to become the standard of dry eye care, as long as the doctors can afford it, because this technology is not inexpensive. And we always try the least expensive way first, but IPL and Opti Lift is going to have a valuable place at the Lange Eye Institute for helping dry eye patients and patients with, baggy eyelids.
Right. And we're also aware eye drops, they're not cheap either. And we have many patients that they've got, about 10 different bottles of different eye drops that they've tried, and they sit there in their cabinet. It's also difficult to put the drops in during the day. A lot of patients struggle getting drops in, and then it's just getting that regimen of 4 times a day with drops. That's also difficult. So if we can actually find a way where we can reduce the dependency on those over-the-counter teardrops that so many people try, we can actually get to the root cause of the problem and get those glands that are supposed to release those oils into the tear film to just get your own tear film much healthier, then it's worth the cost to a lot of people because we're actually getting to the root cause.
And the Lumenis, we picked the Lumenis. I mean, Dr. Summerton and I looked at probably 8 different devices there that were at the show. And we picked Lumenis. It was the most expensive, but Lumenis IPL is the first and only FDA-approved light therapy for dry eye. So it's the only one FDA approved, and it's the first in the market. So we want something that's FDA approved for the purpose at hand for the dry eye. So once again, it's not available yet, but it will be coming to the Lange Eye Institute very soon. Sometime in this month, we're hoping. It'll probably be toward the end of the month. So if you want to see if you're a candidate for a non-surgical way to give a revived look to your eyelids, helping to get rid of the baggy eyelids, the eyelids that aren't working well, and help with your dry eye dramatically, come to the Lange Eye Institute. Set up an appointment to see me or Dr. Summerton to see if you are indeed a candidate. And we can go over the pricing and how many visits it takes. So the phone number for the Lange Eye Institute, write this down. I'll give it to you twice. And that's in the Villages, Florida, is 352-753-4014. That's 352-753-4014. And this kind of goes hand in hand with the light therapy that we're looking into investing in called Velita light therapy, using frequencies of light for macular degeneration, which is now FDA approved. So we're actually in the process at the Lange Eye Institute of building out a new wing. Maybe we'll call it the Macular Dry Eye Aesthetic Light Institute or something like that, where we're putting these new generation frequencies into our institute that will help literally turn back the clock and help with the aging in the eye. And we're about finished the build out. We're putting the flooring in as we speak this weekend. The paint's going up, and hopefully in a few weeks, we'll have all this new technology over on the new side. And we just invested in a new OptoMap. And I always tell people OptoMaps is the best way to actually look at the peripheral retina. And I tell people, if you're looking for an optometrist or an ophthalmologist, call them and ask if they have the OptoMap, because that is a valuable piece of equipment in detecting diseases. And we got 2 OptoMaps now at the Lange Eye Institute to help with flow. We want to run on time, don't we, Dr. Summerton?
We do. Some of our patients, they know we can have a waiting room full of patients because we have 3 doctors that are actively seeing patients all day. And so it's important to make sure we know we can see those patients, but we have to have the right flow and the right amount of equipment so we keep patients happy. We don't want them to have to waste time sitting in the waiting room, and we want to make sure they get good quality care.
All right. You're listening to Ask the Doctors this morning. We're live. It's March 1st. Give us a call at 813-282-8283. That's 813-282-8283. No matter how simple or complicated your questions are, we'll try to answer it to the best of our ability. If you haven't seen an optometrist, an optometric physician, or an ophthalmologist lately, you may want to set up an appointment to see one of these eye care providers, because believe it or not, an eye exam may not only be vision saving, but ultimately it could be life-saving. That's absolutely correct. The eye is the window to the body. We can detect many systemic diseases through the eye. Things like high blood pressure, diabetes, arteriosclerosis, many autoimmune diseases, all right? Even sexually transmitted diseases, thyroid problems can show up in the eye. So not only are we looking for glaucoma, macular degeneration, retinal holes, retinal tears, things of this nature, we're trying to do kind of a systemic evaluation of your health. So you can see clearly now that an eye exam may not only be vision saving, it could be life saving. So see your local eye doctor. We got lots of great eye doctors throughout our country, and make sure you're happy with them. Make sure they're going to spend that time to go over each and every diagnosis. Dr. Summerton, we listen to our patients and we go that extra mile. Since we're both certified nutrition specialists as well, we counsel them on diet. We counsel them on weight management, what foods to eat, what vitamins to take. And I think we go that extra mile and we spend a allotted amount of time necessary with each patient to get the job done, to go over each and every diagnosis and all the treatment options, not just surgical options, but natural and holistic options that may work just as well, if not better. And we are big advocates of the least amount of surgery, the least amount of medication that gets the job done. And I think a lot of doctors, It's kind of like wham, bam, thank you, ma'am. It's a conveyor belt and they don't spend time. And we hear this all the time that it's the highest quality exam they've had, right?
And we want to be your primary eye care doctors. We want to take care of what you came in for. A lot of times they have been rushed through and they think it's just about getting in, getting their prescription for glasses and getting out. But it's not just about getting their prescription. We want everybody to be able to see 20/20, and that's that perfect vision we aim for. If you're not seeing 20/20, we want to find out why you're not seeing 20/20. And a lot of times people come in just for that routine eye exam thinking they're just going to update their glasses. And with our great technology, like you mentioned, the OptiMap that we offer every patient that comes in the door as a screening, we'll discover something that the patient didn't know they had. And then we can actually take care of that and ensure that they don't. We want to make sure they're not going to lose any more vision, and we just want to keep their eyes healthy. Thus, eyes are an extension of their brain, so we want to make sure their eyes and their body are maintaining and keeping healthy.
All right, the phone number for Fortify Vitamins, write this down, and Charlene is answering the phones today. Don't leave a message. Call her back if she can't get to it because she gets really inundated, and I appreciate her coming in on Saturdays on her day off. So the Fortify Vitamin phone number is 866-503-9746. That's 866-503-9746. And you can also order at fortify.com. This is a very secure site, fortify.com, Fortifeye, fortify.com. All right, before we go to the next call, listen up, men. All you men, you got to listen to this. We try to share things for men and women, but this is especially good for men. There is, first of all, a website you can go to check all this out. It's called healthbenefitsofomega3.com. Healthbenefitsofomega3.com. Check that out. And the most recent post talks about omega-3 for men with prostate cancer. There has been a new study that came out. It shows that diets that are high in omega-3, low in omega-6, all right, and taking omega-3 fish oil curbs the growth of prostate cancer cells. This is called the CAPFISH 3 study, not catfish, CAPFISH, CAPFISH, CAPFISH 3 study, and this is phase 2. They just released this at the 2025 American Society of Clinical Oncology Cancer Symposium just recently. I mean, this last month. So it's amazing research, increased omega-3, decreased mortality from prostate cancer, and decreased progression simply by taking a supplement. And we are big advocates of omega-3, the right form of omega-3. Of course, we recommend Fortify Super Omega or Fortify Super Omega-3 Max. But last week we spoke, or the week before, we spoke about omega-3 and sports performance because a study came out with omega-3 decreasing recovery time and being great for athletes. So it's pretty amazing, Dr. Summerton, all the new innovative research that's coming out with nutrition, proper nutrition. And I think just about everything. We talk about all the diets. We talk about the carnivore diet, the paleo diet, the ketogenic diet, the Lange survival diet. But with all these diets, all the evidence points to consuming more fish and omega-3 fish oil is beneficial, right?
Absolutely. And that study that you were talking about, the one that focused on prostate cancer, that means you've got to eliminate your fried foods and your processed foods. Those are the ones that tend to be high in the omega-6. And then choose the foods that are high in omega-3s, like your seafood, salmon and tuna, and help that with a supplement of good quality triglyceride form omega-3.
All right, I see we got a lot of people chiming in on social media. Let's see, Frida, can you suggest a treatment for macular degenerate eye disease in the UK? All right, so Frida, in the UK, if you have macular degeneration, the dry form, I think you can certainly see an optometrist, an optometric physician, or an ophthalmologist. If you have the wet form, you're going to need to go to a retina specialist, and chances are you're probably going to have Avastin injections or Lucentis or Eylea, one of the new generation anti-VEGF injections. But if you're in Europe, you might want to look into the Velita light therapy. All right. So I don't know where they're doing it in UK. If they're doing it in the UK, it's brand new technology, but it's been in Europe for a few years. And this uses a frequency of 3 lights for the dry form of macular degeneration. So Frida, look for Velita light therapy. Who's doing it in your area? If you have the dry form, if you have the wet form, go to a retina specialist, an ophthalmologist fellowship trained in retina. Make sure you eat plenty of dark green leafy vegetables, especially baby leaf kale, orange bell peppers, wild Alaskan salmon, saute it in coconut oil, all right? Take a good omega-3 supplement. Take something like the Fortify Next Gen Macular Defense. We do ship to England and the UK. Fortify Next Gen Macular Defense. If you can't get it, then go to the website at fortify.com. Look at the ingredients that are in the Next Gen Macular Defense and start taking that. Like I said, orange bell peppers, goji berries, eggs, pistachios. All of this is good. Exercise, get down to your ideal body weight, wear a good pair of sunglasses. This is something Dr. Summerton and I go over on a daily basis with our patients. Dr. Summerton, what would you recommend for patients, in the UK with macular degeneration? I might have covered all my bases, but I don't always.
I think you did. The diet, the green leafy vegetables, and you mentioned the nice little snacks there. I love telling patients about goji berries. That's like a superfood for your eyes, and they're not hard to find. You can find them in the grocery store. Normally they're in kind of the raisin section there, and you can find ways to sprinkle them on your salad or make like a little trail mix with the pistachios like you mentioned, and just kind of have fun creating new healthy ways. And we want to focus. I know it's sometimes really difficult to get onto that healthy plan, and sometimes it's more helpful to start thinking about adding the good in, fill your body up, make your body crave healthier foods by starting with a foundation of good quality protein. That's going to send the message to your brain. You've got all those essential amino acids. And so it's going to tell your brain you're satisfied and you're full. So that will start eliminating those cravings for the bad foods. And then if you're still wanting something, think about something good to put in, like the goji berries or the pistachios, something more of a healthy snack. And you'll find after you do that over a while, it might not happen overnight, but you'll start wanting those bad foods, the fried foods, less and less, and you'll feel more satisfied on the healthy foods.
And you do bring up a valid point, protein. You got to pound the protein. Think about it. Steve, stay patient. We're getting ready to take you, my friend. Got to pound the protein. Most of you that are listening to Dr. Summerton and I right now, what did you have for breakfast? Maybe you didn't have breakfast, okay? But you had a donut, all right? You had a piece of toast. You said you had a bagel. You had oatmeal. You had some orange juice. You had some, colorful sugary cereal. I had 5 eggs this morning, all right? And I had some slices of grass-fed bison, and I did have a pomegranate also, so a little fruit. You got to have protein. You should try to get 35 to 50 grams of protein right when you wake up, depending on your weight. Now, if you only weigh 80 pounds, you probably don't need that much. But you got to load up on protein first thing in the morning. And we try to target 1 gram per body weight. That's all the latest science. 1 gram per body weight of protein. If you're especially trying to build muscle, you're fairly athletic, you want to thrive instead of just survive. And I know a lot of you are on the carnivore diet and the ketogenic diet. Those are fine diets, but I like a modified form of these diets better. So if you want to be on a carnivore diet, or you want to be in ketosis almost all the time, you may want to consider after you work out, all right, having some fruit or some honey, because we got to replenish muscle glycogen. And we're going to talk about that in a few minutes. There's a new study that just came out, and Dr. Summerton just sent it to me the other night about carbohydrates, how important they are post-recovery, and the right amount of protein. But first, let's go to the phones. Let's go to Steve in Clearwater.
Yeah, this is Steve. One thing I might advise that lady in the UK is that in the UK, people have very low vitamin D levels for 2 reasons. Now, this doesn't have anything to do with her macular degeneration. Number one, they're at a very high latitude. If you look at the map of the globe, the latitude of England is almost exactly is in almost mid or North Canada. If you look straight across, they're like in the 50s, you know, way north, much more north than people realize. So people in England, and another thing is, you know, the term London fog. Well, when there isn't rain, there's a lot of fog. A lot in England. It's a very cloudy country, and therefore they're not getting the vitamin D sunlight very much because of the atmospheric conditions that the Gulf Stream comes up with warm water and the cool air comes down from the north, forms a fog or a mist all the time. Secondly, I think a name for your new red light center, I have a new name for it. I think you should name the center the Octares 2 Center.
Okay, explain.
Octares is a star. It's known Antares. That means anti-Mars. It means it's away from Mars. The star Antares is a red giant star. That means it emits almost all red light. And it would represent the red light that you're using in your therapy. And so you could call it the Antares 2 Center.
Interesting. I'll take that under advisement.
Yeah, there you go. And that's my weekly useless comment for the day.
Steve, I listen up, big boy. I have a London fog trench coat and a London fog jacket. That from England, you think? You think it's made in England?
I didn't hear that. You blacked out.
I said I have a London fog trench coat or a London fog overcoat. You think that was developed in England because of all the fog?
Yes, it was, because the fog comes up and it forms a mist. And the thing about it was that London fog coats were designed to prevent that mist from, you know, coming through, because you would get damp, and they were sort of water repellent.
Right.
But you didn't want a raincoat. You wanted something more dressier. And so that's where it came from.
Right.
That's exactly where it came from.
Steve, you're always filled with a wealth of knowledge, my friend. We always enjoy your calls.
Okay, very good. And I hope you guys have a fantastic day. And we'll look forward to hearing from you next week.
All right.
God bless.
You're listening to Ask the Doctors, Dr. Susan Summerton and Dr. Michael Lange, both of Fortify Vitamins and the Lange Eye Institute. If you have a question regarding your vision, eye care, or you want to share something with us that has to do with the topic, give us a call at 813-282-8283. That's 813-282-8283. We're still waiting for some calls from our Texas stations. You guys in Texas, maybe it's too early to get up and wake up and call. But if we're coming in loud and clear on the Texas network, give me a call at 813-282-8283, or at least call and let the operators know that you're picking us up in Texas at 813-282-8283. All right, so there's another really cool piece of equipment we just bought for the Lange Eye Institute that will actually enhance our ability to detect diseases in the earliest stage. And it's made by OptiView and Vision Onyx, and it's a new generation form of OCT. It's called the OptiView Solix OCT-A. And what this does, it allows for visualization and quantification of the retinal vasculature. Most OCTs will look at the retina itself. This looks at the tiny little capillaries and blood vessels, the vasculature, and helps us detect all sorts of things in the early stages. It's going to be a godsend for diabetics, because we have diabetics out there that we take a picture, we look in their eye with the microscope, we do an OCT, and everything looks totally fine, all right? And their hemoglobin A1C may be elevated, it may be normal, but if we do this OCTA, we can actually see capillary dropout. We can see areas of hypoxia, areas that are starved for oxygen, before the irregular blood vessels grow in and bleed, and before we see these dot and blot hemorrhages. So we can detect this in the earliest stages. Then maybe you don't need medical treatment. Maybe we can adjust your diet and get you to lose weight, put you on specific supplements to actually decrease the chance of you getting full-blown diabetic retinopathy. So our diabetics, we're going to probably run this on all of our diabetics automatically. And also macular degeneration patients. When we have these PEDs or drusen, these pigmented epithelial detachments, we can look under that now to see if that's actually a neovascular net, an irregular blood vessel that's getting ready to break and bleed, once again, the wet form of macular degeneration. So this technology just allows doctors at the Lange Eye Institute to take it to the next level. It's pretty exciting, isn't it, Susan, that we have this technology and we're able to afford this technology to not only hone in on our skills at detecting things earlier, but to help our patients ultimately.
Right. And that's, like you mentioned, early detection, the better for any disease out there. If we see it before it gets full blown into it, it helps manage it. That's when diet really can make a difference. And you can change it around before you get any bleeding in your eye. Nobody wants bleeding in their eye, because the consequence of that is you end up at the retina specialist, and that's where you end up getting the injections in the eye. And we know that's not pleasant. It's expensive. It's time consuming. It's scary. Patients get very anxious about it. So this gives us a chance to look and see kind of into the future a little bit. So what's going to happen if we don't make changes right away? We're going to see those problems down the road. And it just allows us to see it, and we can actually share it with the patient so they can realize what's going on in the eye. And this is where, we hear of the eyes being the windows to your soul, like it's the windows to your health. With the amount of technology that's coming out, we're looking at these blood vessels that are extension of blood vessels from the brain, and it's giving us all kinds of information on your health. And again, that's why we're kind of looking at, we want to be that primary eye care. We want to take care of it as soon as possible.
Absolutely. And we're going to take some phone calls here in just a minute. We're going to talk about a trick to lose weight that works. And diabetics listen up to this too. But the phone lines are open. If you got a question, 813-282-8283. Give us a call, 813-282-8283. Also, the Fortify Fit Pro Fruit Punch is in. Hallelujah. The Fruit Punch has been the #1 flavor for Fortify Fit Pro. Remember, Fit Pro is a pre-workout and post-workout, all natural. A lot of world-class athletes are using it. We use it. My 97-year-old mom uses it. It's based on amazing clinical studies. It's all evidence-based, fully transparent. You can see the studies on the site at fortify.com. But the Fruit Punch is in. I got to tell you, we're getting ready to run out of strawberry watermelon. We're getting ready to run out of pina colada. But we have plenty of Fruit Punch, and we got an order for the strawberry watermelon, so that should be in soon. But we still do have the strawberry watermelon. Also, I want to mention the Fortify Focus supplement we put in micro caplets now. So when you get the Fortify Focus, it's not this bigger black and red gel cap. It's now more of a reddish micro gel cap. And we did that because we're using a new form of lutein and zeaxanthin made by Kim Industries that actually you don't have to use as much. It's more potent, so we can make it a lot smaller, easier for you to swallow. Also, the new advanced retina formula, we moved away from being a big gel cap. It is in a vegan capsule now. So the advanced retina formula is a vegan capsule. We still have gel caps for Focus, and Brain, and the Super Omega. All right, so the little trick for losing weight, somebody had asked about that on one of these social medias, said I had mentioned a way to lose weight, a little trick a few weeks back. And here's something that I found works. I do it. Dr. Summerton does it also, I think, and a lot of our patients do. So you're going to have to go buy something called allulose and go to Sprouts, wherever maybe Whole Foods, Fresh Market, but get allulose, get that non-GMO or the non-GMO organic allulose. This is a rare sugar. It has some amazing health benefits, okay? It acts like a GLP-1 receptor drug. It acts like a GLP agonist. It helps you feel full, but it supports the mitochondria. It lowers uric acid. It does a lot of things, but it makes you feel full. So what I want you to do, take a teaspoon of allulose, put it in with one of our proteins, our Fortify Vanilla Super Protein or our Fortify Vegan Super Protein, one of the flavors. Take a teaspoon of that, put it in there, take a teaspoon of organic ground flax for the fiber, and then take a teaspoon of Ceylon cinnamon. Make sure it's Ceylon cinnamon. So the cinnamon, the flax, the allulose with our Fortify Super Protein or our Fortify Super Vegan Protein, and then just shake it up or blend it for 5 seconds. Drink that, about 4 o'clock, 3:30, 3:45, 4 o'clock, an hour and a half before supper. What this is going to do, it's going to make you eat a much smaller supper. And your supper, if you're really trying to lose weight, can just be protein. But most of you, when you're just consuming protein for supper, you're still hungry. So that's when you go into the pantry and get a bag of Fritos or, some ice cream or cake or pie or pasta and rice. So do this little trick an hour and a half before supper, and then supper is only protein, and you'll lose weight. You'll lose weight pretty quickly. And you were one of the ones, I think, that turned me on to the allulose, Dr. Summerton.
I was. Allulose it's a natural sugar that comes from corn, raisins, dates. So it is a natural product. And I'm a big fan of it. I've talked about, I make that ice cream out of the whey protein cottage cheese and plain Greek yogurt. And I always add it to that. Now, if you're a high sugar fan, it's not a super sweet sugar. So that's part of getting all those high sugars out of your diet. So your taste buds become more normalized so they can sense the sweetness of things better. So when you have less sugar in diet, this allulose actually does taste a little bit sweeter. But they've done studies, and like you mentioned, it activates the GLP receptors. And they've done studies on people wearing their glucose monitors. And even if they put a little bit of this sugar in before they eat a carbohydrate, they don't have a high response in their blood sugar. So it helps maintain blood sugar regulation too. It's not to substitute any medicines, but it's a way to add a healthy sugar. We finally have found some kind of sugar that we're, as nutritionists, we're advocating it's good to use. And we're not the only ones. It's become really popular. That's kind of the hot topic. What people are talking about in nutrition is just finding little healthy ways, just a teaspoon of that sugar to help you as well as sweeten things.
Anything to keep us above ground to 110 at least. All right. Let's go to the phones. I think it's maybe Sherry. Sherry, thanks for holding. Good morning.
Good morning. I'm just calling to see any hints to help deal with arthritis.
Aha.
Or eliminate it.
My dad was a rheumatologist, and he was actually a guest a few times on my show. Geez, this is 30 years ago. So I grew up in a family, the rheumatology was talked about, believe it or not, at the supper table. And I dealt with a lot of his patients. When I practiced in New Orleans, he was at Ochsner Hospital, head of rheumatology at Ochsner Hospital, and I was at St. Charles Vision, for those of you that are listening in New Orleans. And, he would refer a lot of patients for me that are on, Plaquenil and prednisone and methotrexate to look for the potential complications that not only the disease has in the eye, but that the medications can have in the eye as well. Remember, the eye is the window to the body. So as you know, with arthritis, especially rheumatoid arthritis, there's an inflammatory component there. And so number one, all right, one of the best things in the world, once again, I'm not a rheumatologist, but I am a certified nutrition specialist, and I've been dealing with arthritis forever. My daughter, who's 19, actually has arthritis, and it might be from playing so much volleyball. And I've worked some things out with her, and I've developed some things that have actually brought her inflammatory markers down considerably. So obviously, I think seeing a rheumatologist is a good idea, following their directions. But for an educational little seminar here about arthritis, what can you do? Number one, if you're overweight, you got to get down to your ideal body weight. So if you're 150 and you should be 120, you got to lose 30 pounds. If you're 400 and you got to be 200, you got to lose 200 pounds. That's the number one thing you can do for overall health, including arthritis, is getting down to your ideal body weight. Because remember, the joints are inflamed. And if you're overweight, every pound that you're overweight will be 4 pounds on your knees and 6 to 8 pounds on your ankles. So taking the weight off is going to take the pressure off of your joints. But when you're overweight, cortisol levels go up, all inflammatory markers in your body go up. So number one, getting down to your ideal body weight. And you do that with a good diet. I recommend patients that have arthritis going on my Lange survival diet. You can Google that, Lange survival diet. And the reason for that is we have taken all of the fruits and vegetables and foods out that are high in anti-nutrients that are inflammatory, pro-inflammatory. So we've taken out all the alkaloids, the phytoestrogens, the lectins, the phytic acid, the FODMAPs, the gluten. So I've done all the homework and all the research. So get on the Lange survival diet. That will help you lose weight. Believe it or not, a little sunshine. If you live in the summer areas in the South, you can get some sunshine. That gives you the vitamin D. And there's studies that indicate that people that have a good tan have less arthritic symptoms. So the question is it the vitamin D or is it something else that's in the sun? So don't put sunscreen on for that 30 to 45 minutes that you're out in the sun, and get some sun. So lose the weight, get some sunshine, anti-inflammatory diet. And then there's a few nutrients that I recommend. We have them all rolled up into one. It's called Fortify Omega Relief Extreme. Fortify Omega Relief Extreme. And what we're doing, we're using Super Omega 3 Max. We're using Fortify Focus that has some anti-inflammatories. No, curcumin, next gen curcumin, which is a great anti-inflammatory. It's curcumin, and then black currant seed oil. So I recommend that. And I also recommend something we developed recently called Fortify Rejuvenate. It is kind of an anti-aging wellness powder. It has lots of anti-inflammatory products in it and also things that are good for your skin, hair, and nails. So now if you follow my instructions, we're literally going to reverse the aging and make you look younger, feel better, and look better and feel better, like I said. So the diet, the sunshine, weight management, Fortify Omega Relief Extreme, Fortify Rejuvenate. And if you don't want to buy the Fortify products, use those as a template when you go to the website to determine if you can buy something similar, at your local health food store. And then obviously positive mindset, plenty of sleep. Sleep is important. If you're sleep deprived, inflammation goes up, and hydration. You got to drink a lot of good spring water or filtered well water. Just stay away from the tap water. But inflammation is the root cause of many eye problems. So we're experts in the area of inflammation, so we can parlay that into helping you with arthritic symptoms. And Dr. Summerton is also an expert in, ocular inflammation. I want her to chime in on this.
And I agree, everything you said. If you have a disease that ends in itis, like arthritis, that means you have inflammation. And so the root cause is the inflammation. So we want to do all we can to lower it. And we know you want to control that diet. We want to get rid of those inflammatory foods that are, like we talked about, the omega-6, the seed oils that are in a lot of the processed foods and fast foods. There's some awareness now of those seed oils. I think it's Steak and Shake. I can't remember which fast food restaurant is actually taking the move and changing from seed oil to tallow because they know the seed oils are very inflammatory. And so there's this growing awareness of what we eat causes inflammation. And so we want to eliminate the processed food, the fast foods, the fried foods, and put in those good quality proteins so your body isn't trying to just fight inflammation all the time. And because it is hard to get that perfect diet from the perfect foods, that's where the supplements come in. So we have to supplement what we're missing in our diet, not substitute. We have to have the core foundation of our diet and supplement with all those things that Dr. Lange mentioned.
Thank you.
I know, Sherry, we went over a lot of stuff pretty quickly, and you can always go back. If you go to our YouTube channel, just go to Dr. Michael Lange Ocular Health on YouTube, and we'll post this a few hours after the show, and you can always go back and listen to it again, and we'll have a synopsis on there.
Good, because I'm writing as fast as I can.
And remember, take the advice of a rheumatologist, but our goal is to minimize the amount of systemic medications that you will need for your arthritis. And sometimes this works amazingly well if you follow the directions that we just gave you.
Thank you very much.
All right, Sherry, you have a great Saturday.
You too. Bye-bye.
All right, we're going to talk about another new study. It's interesting, and Dr. Summerton brought this to my attention just, I think, yesterday. And we've been preaching this forever, but now there's a study proving this. So all of you guys and gals that are into sports nutrition and working out a lot, there is direct clinical evidence now that if you have a 3-hour delay of consuming carbohydrates after working out, so you don't have a meal or you don't have your carbohydrates for 3 hours after working out, 2 to 3 hours, leads to a 30% reduction in next day exercise performance and then an increased effort perception. So the take home on this is immediate carbohydrate replenishment is necessary for optimal recovery, for sustaining high intensity performance. So once again, those of you that are on the ketogenic diet, the carnivore diet, and not consuming any carbohydrates, I'm always asking you, do you want to thrive or just survive? If you're in the gym pumping iron, you're on the golf course, you're out of the basketball court, the tennis court, the pickleball court, you have to replenish muscle glycogen. So immediately, that's why we take Fit Pro with some protein and then maybe add chocolate milk or blueberries or strawberries or pomegranate or honey to it right after you're working out. And all of those with the sugar tooth out there, that no matter what, you're going to eat your ice cream, your pumpkin pie, your pecan pie, no matter what, then go to the gym and pump iron, work out, and then have it right after you work out with some protein. And we have really been preaching this for a while, haven't we, Dr. Summerton?
We have. It's about that balance and giving your body what it needs. And, there is so much conflicting evidence out there and studies that say one thing and then the other, but it really comes down to getting that balanced diet and the common sense kind of things. If you're exercising at high intensity, you are using those carbohydrates. So we do have to replenish it. I know myself, I was a little shy of getting those carbohydrates because we think, oh no, that's going to make us gain weight. But if you're using them in the gym, you're doing, or outside, you're playing pickleball, you're doing tennis, you're doing those, that's utilizing it, that's when you want to eat the carbohydrate. And they do stress immediately right after you're done. Don't wait 3 hours. That was what they were studying. If you wait long, then it doesn't have that benefit for you the next day. And so, like you said, if you're going to have the carbohydrate, that's when we want you to eat it, is after the exercise.
And I want to wish a happy birthday to one of our loyal viewers, and that's Iwa Hubacher. Happy birthday. Hope I didn't say the name wrong, but happy birthday and have many, many more. So post-workout, our Fortify Fit Pro is one of the best things on the market. I mean, we've done the research, fully transparent. You can look at the studies on the website. Fortify Fit Pro can be used pre-workout and post-workout. And after you work out, we recommend adding a little extra protein. Heck, you could put chocolate milk in there and some honey or some blueberries to have those carbs right after you work out. You don't need carbs throughout the day, but right after you work out, once again, if you want to thrive instead of just surviving. Also, I'm going to talk really quickly. There's a new study on dementia that just came out that shows that you can reduce the chance of you getting dementia by 69% if you exercise 140 minutes a week. That's not much. That's like 30 minutes a day. But if you only exercise for 35 minutes for the entire week, it decreases dementia by 41%. So a minimum of 35 minutes a week, and preferably more like 140 minutes per week. And it's going to reduce your chance of dementia by 69%. That's pretty crazy. We got 35 seconds. Remember, check us out at fortify.com. Dr. Summon, tell everybody goodbye in 10 seconds.
Thank you for listening. Go out, do something good for yourself today. Make it a healthy one.
All right. And thanks for everybody tuning in. The Fortify phone number is 866-503-9746. Learn more at fortify.com. With that, I want to thank everybody for tuning in and listening to Ask the Doctor. I'm Dr. Michael Lange, helping keep America healthy.